Hello everyone, warm welcome to today's class. It's a very important class because we are starting with a new chapter. It is equally important as it was, as we have seen in last week's class. So let us do a small prayer and then we'll start the class. Just close your eyes, take a deep breath in and exhale. Another deep breath in, exhale. One more deep breath in and exhale. Remembering our parents and gurus, receiving their energy. We start today's class. Okay, so in the last class, we spoke about pain, right? I hope every one of you could follow what pain is and what are the different types of pain, how will we diagnose this pain, and how will we use this knowledge of human body to treat pain through acupressure, right? Similarly, today we'll discuss about one more ailment which is very important, and you'll get many patients who come for this particular ailment, and that is joint pain. Those who are treating or those who are already seeing patients, you will find that 60 to 70% of the patients who come to you are suffering from different types of joint pain, whether it is knee pain or any type of back pain or cervical spondylitis or lumbar spondylitis or pain in the ankle, pain in the wrist, carpal tunnel syndrome. So any one or the any other type of pain the patient suffers from. So today we'll understand what are the different types of joint pain and how can we differentiate between all these types of pain. And that is why today's class is very important. So pay attention to what we are learning and understanding, because each and every part of this chapter will help you in diagnose your patient in a better way. First of all, when we talk about joint pain, which is also mentioned as arthritis. Arthro means joint, itis means inflammation. So arthritis, that means there must be some type of inflammation or pain or swelling or redness or warmth in that particular joint. But what is a joint? First, let us understand what is a joint, then we'll understand what may be different causes and different types of inflammation in that particular joint. Okay, so what is a joint? What is a joint? The area where any two bones meet is called a joint. The two bones are meeting together, so this particular area is called a joint. Okay. Now this joint can be of different types. This joint can be a synovial joint. This joint can be a cartilaginous joint. This joint can be a fibrous joint, depending on what is the cushion between the two bones. If between the two bones it is synovial fluid, okay, then we call it a synovial joint. For example, knee joint is a very good example of synovial joint. It can be a fibrous joint. If there is fibrous tissue between the two bones, then we call it a fibrous joint. Okay, for example, in this skull, this in between the two different bones, the flat bones, there is a fibrous tissue. If it is a cartilaginous joint, so in between the two bones, you will get cartilage. For example, spine is a very good example of cartilaginous joint, where in between the different vertebrae, you have the cartilage present. Okay. Now, when we talk about each of this type of joint, these joints, where are these present and how to understand what type of joint is present in which part of the body, you have, I'll show you one picture. It's a very beautiful picture, which will help you in understanding. This is an example. This picture is an example of different types of synovial joint. Okay, so I spoke about 3 types of joints. One was synovial joint. Second was fibrous joint. And third is cartilaginous joint. So under synovial joint, again, you will see there are different types of joint. What we are seeing here in this picture. So all these are different types of synovial joint. So whether it is pivot joint, or if it is a hinge joint or saddle joint, plane joint, condyloid joint, ball and socket joint, all these are different types of synovial joint, but I'm not going into that because that is not my topic. If I go into types of joint and explanation of joint, it would be a different topic altogether. So what we need to understand is what are different types of joints. If we just know the names and where are these present, and how, if these joints are affected through inflammation, arthritis appears. Okay, so let us take one example. For example, synovial joint is present in which part of the body? Can you give one example where synovial joint is present? Because we'll take just one example so that we can understand whatever our aim is. One example of synovial joint. Very good. So knee joint is an example of synovial joint. So I'll show you one picture, which is a very beautiful picture of synovial joint. Rather, I'll show you 2-3 pictures so that you can understand and you can relate to these pictures. So it's a simplified, very, very simple diagram it is. So what is present here? This is bone 1. This is bone 2. Okay, just listen to me and understand what I'm telling you. No need to copy because everything is there in the books. Everything is there on internet. Just understand the topic. This is bone 1 and this is bone 2. In between bone 1 and bone 2, there is a fluid present here. Okay, which is called synovial fluid. See another diagram. So this is bone 1, this is bone 2. In between the two bones, there is a cavity present here. In the cavity, which is called the synovial cavity, you have the synovial fluid. Okay. Outside the synovial cavity, you have a cartilage present here. Can you see this? This is bursa, the covering. And also, the two bones are covered by a cartilage, which is called articular cartilage. This is important. This articular cartilage, you remember this term, articular cartilage, because you will come across this term whenever you are understanding arthritis, and especially arthritis of knee. Okay. Third important point here is there is a ligament which is present on the knee. This ligament is also very important to know and understand. Okay. Now what happens is, what is the importance of this synovial fluid which is present here, or what is the importance of this articular cartilage which is covering the bone? Both are preventing excess friction between the two bones, bone 1 and bone 2. Can you believe we use these joints for the whole lifetime without any servicing? Do we ever think about the knee? That, okay, my knee is getting folded, my elbow is getting folded, my arms are folding up and down, left and right. But all the time, we are just using these joints without any intention or knowledge and or any direct convey to the joint that, okay, you move. Now I'm expecting you to move. So when it is moving all the time without our knowledge, we are using the two bones which are moving one on the other. Right? And whenever two bones are coming in contact with each other, there is a lot of friction between the two. And whenever there is friction, then what will happen? There would be erosion. Erosion means degeneration and loss of the surface. So to protect the bone from loss or from erosion or from destruction, there is a covering present here, which is called the articular cartilage. And also in between the two bones, there is a fluid present here, which will give a cushioning, which will protect it from getting eroded. Is this okay? Is this clear to everyone? So that is the role of synovial fluid and cartilage, which is present in the synovial joint. We spoke especially about synovial joint because these are out of three, these are the type of joints which are very, very frequently used by us because these are present in the major joints. This type of joint are forming the major joints of the body. Okay, I'll show you one more picture, which is also very interesting picture. Very simple. You can just take a picture of this. You can take a screenshot of this because this is bone 1. This is bone 2. This shows the synovial membrane. This is the synovial membrane. It is a synovial cavity, which is filled with synovial fluid. Okay. This is the cartilage, which is covering the bone 1 and bone 2. And this is the ligament, which is present outside the synovial joint. Okay. So this structure is very important to know and understand because whenever a patient is coming to you, for example, whatever type of joint pain it is, whatever is the cause of joint pain, whatever is the type of arthritis, if a patient is coming to you and says that there is some fluid which is dried up in my knee, and if you don't understand what is that fluid, what is that fluid? I hope now all of you know that what is that fluid which is present in the joint. What is that type of fluid present in the joint?
Synovial fluid.
Synovial fluid. If the patient says that there's a lot of swelling, there's a lot of inflammation and warmth, the patient will not use the term inflammation. The patient will say there's a lot of my knee is or my this particular joint is very warm. It is hot. It is warm to touch, and there's a lot of swelling in that area. You know what that is? That is inflammation. Well, where is that inflammation? That inflammation is in the joint itself. So maybe there is a lot of fluid retention in that. So where is that fluid getting accumulated? It is getting accumulated all around the joint. Okay. But if you don't understand what is the structure of the joint, how will we treat it? Okay. So that is why this particular structure is very important to know and understand. Now, these joints, according to movement, can be of 3 different types. What are the different types of joints? There are 3 different types of joints according to the type of movement. According to the type of movement. For example, first one is uniaxial joint. Uniaxial joint. What is uniaxial joint? If the joint is moving only in one direction, then we call it uniaxial joint. Can you give example of any joint which is moving only in one direction? It is unable to move in any other direction. What is the example? Elbow. See, elbow is only moving in one direction. So it is an example of, yes, it is an example of uniaxial movement or joint. Okay. Second one is biaxial. Biaxial means the type of joint which can move in 2 directions. Then we call it biaxial joint. For example, wrist.
Wrist.
Yes, wrist is an example of biaxial joint. Third type of joint is, which is called multi-axial joint. That means it can move in different directions. Can you give an example? It's a very common example. Yes, I can see Neeta ji rotating her arm. So shoulder joint, hip joint. Yes. Yes, even neck joint. is an example, our example of multi-axial joint. Okay. Now, why these joints are important? What is the role of, when you say that movement, for movement, we mentioned about the different types of joints. That if the movement is in a particular direction, we call it unidirectional or uniaxial. If the movement are in two directions, we call it biaxial. If the movement are in different directions, we call it multi-axial joint. But have you ever thought that what are the different types of body postures we are making with the help of these type of joints? What are the different types of movement? Okay, now whatever picture I'm going to show, take a screenshot of that, because whenever you are making a prescription of your patient and the patient says, I'm unable to take the arm away from the body, it hurts here. How do you write? Patient is unable to take the arm away from the body. But if I give you one term for that this is a term which that you will use. If the patient is unable to fold the leg, there's a term for it. If the patient is unable to bring the arm close to the body, again it hurts. There's a term for it. If the patient is unable to take the leg away from the body or towards the body, every movement has a certain name. So you need to learn and understand the term related to that. So this is a very important picture which has actually all the explanation. See, I'm just zooming it for you. You take a screenshot and then you zoom and see what is shown in each of the picture. For example, in the first one, if the patient is moving the arm forward, this is called flexion. Whether it is flexion of the arm or flexion of the leg. So bringing it close to the body means flexion. If you are taking the arm away from the body, then it is called extension. Similarly, if you take the leg away, you're bringing it forward. See, when you're bending it back, you are actually bringing it close to the body, right? So it is flexion. Whenever something is bending, it is flexion. If something is getting extended, it is called extension. Extension means extending. Understand this and remember this. Whenever you are flexing means bending. Extension means extending. That means you are increasing the angle from the body. That is extension. Okay. Similarly, if you are moving the neck close to the body, you are bringing the neck close to the body. So this angle is decreasing. So this is what? Flexion. And if you are bringing it backward, so you are pushing it backward, then it is what? Extension. Okay. So again, it can be related to the arm, it can be related to the leg, it can be related to the neck area. Fine. Similarly, there is another term which is abduction and adduction. These are two very important terms. So if you are bringing the structure of the body close to the body, you are bringing it close to the body, then it is add. You are adding. Remember like this. So we call it adduction. Isn't it easy to remember if you correlate it with some simple terminologies? So I said, when you are bringing it close to the body, your arm was like this, you're bringing it close to the body. So you're adding the arm to the body. So we call it adduction. And if you take it away from the body, then we call it abduction, AB. Okay. Circumduction is rotating the arm all around. And if you're rotating the leg outward, we call it lateral rotation. And if you rotate it towards the center line, then we call it medial rotation. Now, why these terms are important? Because all these terms, for all these terminologies, joints are very important. Joint play a very important role if the body is moving in a certain direction. Is this okay? Correct? So we not only learned about the different types of joints which are present in the body, for example, synovial, fibrous, cartilaginous joint, but also we learned about different types of movements the body is making with the help of these type of joints. Okay. Now we come to the most important part of the chapter, which is arthritis. Now, how joint is related to arthritis? How joint is related to arthritis? Why are we talking about joint when we are talking about arthritis? Because arthro means joint. Okay, itis means inflammation. So if there is any inflammation in the joint, then we call it arthritis. And you'll be surprised to know and understand that there may be more than 200 types of symptoms and ailments for which you may use the term arthritis. More than 200 symptoms. For every symptom of which, for that you will say that it may be arthritis. What is the most common symptom of arthritis? The most common symptom of arthritis is stiffness of the joint, pain in the joint. Okay, and the patients will say that I'm unable to move the joint easily. So these are few of the symptoms which we discussed about. There may be many other symptoms, but these are the most common symptoms. A patient will say that I'm having this particular problem, and you'll think about, okay, this patient may be having arthritic problem. Okay. Now, one thing we should remember is, it's a very important and very beautiful point. It says that stiffness of the joint is not equivalent to arthritis. Did you get my point? Our stiffness of the joint is one of the many symptoms of arthritis, but only stiffness of the joint does not indicate that the person is suffering from arthritis. Why? Because there can be n number of diseases for which the person or the patient may suffer from stiffness of the joint. Because if someone is having any type of trauma or injury or bone related diseases, maybe cancer, some type of medications, the patient is not moving, this may also lead to stiffness of the joint, but that does not mean the patient is suffering from arthritis. So whenever a patient says that I'm having stiff joint, you need to talk to the patient to understand what are the other symptoms, and also what is the lifestyle of the patient. Understand this. This is also very important. What is the occupation of the patient? This is also very important, because whenever a patient says that I am into an occupation which requires more of sitting work, I'm sitting for maybe 7, 8, 9 hours continuously, don't you think the patient will complain of stiff back or stiff neck or maybe shoulder pain or heaviness in the shoulder area? But does that mean that the patient is suffering from arthritis? So we need to understand what is the lifestyle of the patient, what is the occupation of the patient, and what are the other symptoms of the patient. These are very important to know before we confirm that, okay, you are suffering from arthritis. Arthritis can be of different types. Arthritis is not one problem. If you come to the conclusion that the patient is suffering from arthritis, then you need to understand, you need to find out, and you need to diagnose what type of arthritis the patient is suffering from. Okay. We'll start with, there are a few arthritis, types of arthritis which are mentioned in the book, and we'll take one at a time to understand what may be the different types of arthritis. And the first one under that is gout. What is gout? What is gout? Gout is a type of arthritis. This is number one. Okay. Gout is a type of arthritis which is, yes, very good. So this is a type of arthritis which is caused by high uric acid. that is what we are understanding, what type of acid it is, why it is getting deposited, why it is not getting eliminated from the body. So what is this uric acid actually? Uric acid is nothing but, yes, uric acid is nothing but an end product which is produced by breakup and decomposition of purine. Yes, protein. So purine is a type of protein. So purine based products. Now, this is your homework. What you need to do, you Google, you find out what are purine based foods. One example I'm giving you, for example, those who are non-vegetarian, red meat is a very good example of purine based product. Why? Because it is high in protein. So find out what are purine based products, because if you know what are purine based foods which a person can take, or which are the most common purine based food, then you can ask the patient to avoid. Yes, there are many. Make a list of purine based food and you share it in the group. Whoever makes it, share it in the group. Okay. And you can ask the patient to avoid those type of food. Vegetarian, non-vegetarian, both. So whenever a patient takes purine based food, purine ultimately gets converted into uric acid. Uric acid is the excretory material of the body, nitrogenous. It's a nitrogenous substance. So whatever is nitrogenous for the body, our body throws it out. It's not useful for us. It is highly nitrogenous. It is highly toxic for the body. Okay. So these nitrogenous substances in the form of uric acid is thrown out by kidney. But now if kidney is not well, kidney is unable to throw out that excretory material from the body, uric acid from the body, then what will happen? This uric acid remains in the blood. What is the pH of the blood? pH of blood is acidic or alkaline? It is slightly alkaline, 7.4, right? But if the body retains acid in the blood, then what would be the pH of the blood? It would be more acidic, which is breaking the system of homeostasis. So either we are having more of the purine based food, or the body is unable to throw out uric acid from the body. The kidney is unable to filter out uric acid from the body. In both these conditions, body will have more uric acid accumulated in the body. But how uric acid gets accumulated in the body? Whenever there is excess of uric acid, your body converts that uric acid into needle-like crystals. This is so interesting. That body does not keep uric acid like that. It converts it into needle-like sharp crystals. And wherever there are major joints of the body, those crystals get accumulated. So those are needle-like substances present in the joints. And these needle-like crystals will cause the inflammation, the redness, the warmth, the pain in that particular area wherever there is accumulation. The most common area of the body where the pain actually starts, we always say that uric acid pain starts from right big toe. So if there is pain in the right big toe, if there is inflammation in the right big toe, if the patient says that I'm having problem in the right big toe, the first thought that comes to the mind is maybe the uric acid is high. It is on the higher side. But why right big toe? Why right big toe is related to, it is showing the symptom of more uric acid. Why not any other part of the body? Why only right big toe is affected first, basically? Ultimately, other parts are also getting affected. Because right big toe is the extreme part of the body, most extreme part of the body, where the blood is unable to circulate in its best way. So rest, all of the parts of the body are getting proper circulation, but when the blood is reaching to the most extreme part of the body, that is the right big toe, the circulation goes down. and whatever it is carrying, it is like the river which is carrying the debris with it, and wherever the flow is flowing down, it deposits the debris. Similarly, wherever the flow is less in the body, the debris gets accumulated, and it is nothing but the right big toe. Okay, so right big toe then shows the swelling and inflammation and pain because the crystals are getting accumulated. Then it moves on to the other joints and other parts of the body also. And if those accumulations keeps on accumulating, those crystals keeps on left big toe, it is that if you compare right big toe and left big toe, then right big toe has lesser circulation in comparison to left big toe because left side of the body is getting blood directly from the left ventricle. It is getting the push from the left side of the heart, so it has more circulation. But when it is reaching to the diagonal area, the right toe, the circulation is comparatively lesser than the left side. Okay, so when the depositions are happening again and again and again and again, then it forms some kind of structure, accumulation of structure. You must have seen those type of I don't know if I have the picture, but I'll draw it for you. You must have seen those type of toes where there is, which you call bunion bone, right? So accumulation, yes, accumulation of the fingers are also nodular fingers are there. So this is nothing but, we call it, there's a term for it, and I think it is called, it's in the picture, I'll show you. Tophi. How can I forget it? It's tophi. It's not toffee, it's tophi. Okay, so see this picture. So if this is the bone, this area is the bone joint, then it is getting the crystals, uric acid crystals getting accumulated here, and deposit of uric acid crystal is called tophi, T-O-P-H-I, tophi. Okay, and it forms a nodular structure, whichever joint, whether it is on the fingers or on the toes. So this is about gout, but there are a few other symptoms which are also very, very important to know and understand. For example, there are factors. For example, weight is a very important factor. If the weight, more weight is equal to more uric acid, number one. You need to dissolve these structures. How will you dissolve these structures? You can dissolve these structures through taking more of alkaline. This is one of the way I'm telling you. It is by taking more of alkaline food. If you take more of alkaline food will mix with the acidic food to neutralize it. Another thing is you can take a lot of water. Water also dissolves or washes off the crystals, okay, from the joint. Second important criteria for uric acid is diet. Observe what type of food you are taking. Okay. Third is some medications. Some medications increases uric acid in the body. It is natural if the uric acid is increasing. For example, some high BP medicines, they increase uric acid in the body. So a patient who is taking high BP or hypertension medication since long time and complains of uric acid, then you understand that it is the medication, the side effect of medication that is causing the problem. Okay. Fourth one is, at times it is said that it is hereditary. That means if someone in the family is suffering from uric acid, there are chances that the person who is a part of that family may suffer from uric acid problem. Next is the age. Usually it is seen at the age of 40 to 45. 40 to 45 years of age. And sex more in males in comparison to females, because females normally have lesser level of uric acid in comparison to males. So females, if the blood composition is getting disturbed, then females will take longer time to show uric acid disbalance in comparison to males. Okay, so these are few of the things which we should remember. One more important point, which is though not so very common point, but I am getting a lot of patients stating that particular reason, and that is vaccination. So at times vaccination also aggravates the problem of gout. So after COVID vaccination, whatever type of vaccine it is, I've got many patients who complain of joint pain. Okay, so especially uric acid. So vaccination is one of the criteria which is mentioned to increase or to disturb the level of uric acid in the body. So this is very important that you understand and know that vaccine can also aggravate the problem of uric acid in the body. Okay. What are the symptoms? What are the symptoms? Usually the uniaxial joints are affected. What is the meaning of uniaxial? Uniaxial means the joints which are moving on one side only. For example, elbow joint is an example of uniaxial joint. Knee joint is an example of uniaxial joint. So this is one of the type of joint which gets affected very fast. Okay. Second is, if we don't treat uric acid, see uric acid, if you get uric acid patient, it is very easy to treat uric acid patient. Why? Because it is not irreversible. The changes are not irreversible because these are the crystals which are causing the problem. So if you treat the crystals, if you reduce the crystals in the joint, if you reduce the acidity of the body, if you reduce uric acid in the body, whichever means you are using, through points, through EAV, through EOV, through Chinese acupressure, through Ayurvedic acupressure, whatever medium you use, if you reduce the number of crystals at the joint, if you increase the flexibility of the joint, if you increase the circulation of the body, then ultimately these crystals get washed off from the joint and the person has again the flexible joints. Okay, so it is not difficult to treat uric acid. It can easily be reduced. But if it is not treated for a long period of time, it damages the joint. It is like if your tap is rusted in the washroom, if your tap is rusted and you leave it rusted for a long period of time, and then you feel that you want to remove the rust, and when trying to remove the rust, you actually break the tap, isn't it? So same thing happens here when we are dealing with uric acid. Then if the level goes above the level mentioned, if it should be 5 to 7, and if it is crossing 7, or if it is even at the borderline of 6.5 or 6, remember one more thing: whenever the level is towards the higher side, take it as it is crossing the limit. Don't wait for it to cross the limit. If the patient is coming to you, for example, with uric acid at 6.5, maybe the end line is 7, and you say that okay, it is under the borderline, it is not crossing the line. It's not so. 6.5 already says that it is towards the higher end, so you have to treat 6.5 as uric acid only. Okay, so this was a very important point to be noted. And also, whenever the patient comes to you, he will come with some reports. What are the reports he will come with? For example, uric acid itself, which would show high level, ESR, erythrocyte sedimentation rate, it would be high. Even the neutrophils are part of WBC, right? So neutrophils would be high. And also the X-ray report will show the inflammation and joint degeneration, whatever it is. Okay, so this is about gout. So gout was very important point, very interesting one. Because if you can identify that it is gout, if the uric acid is high, you have several points, very good points to treat gout. We can treat gout easily. Okay. I'm talking about osteoarthritis. So osteoarthritis is another type of arthritis with which you will get many patients. Many patients will come to you and complain that I am having, they will not say that I'm having osteoarthritis. They will say I am having some joint issues. There is some pain in the joint. How will you understand it is joint? This is osteoarthritis. Osteo means what? Osteo means bone. So if there is arthritic symptoms in the bone, we call it osteoarthritis. And the most common reason for osteoarthritis is degeneration, wear and tear, age. So mostly you will get patients who are above the age of 40 show degenerative changes. And remember one more thing, whenever a patient comes to you with osteoarthritic changes, don't get surprised, because even if any one of you get your x-ray done or detailed scanning of the joint done, then you will also get age-related osteoarthritic changes. This is what is mentioned in the report. Okay, so age-related osteoarthritic changes is natural, it's normal, because definitely there would be wear and tear in the body with time. Okay, especially the symptoms appear after the age of 40, because continuously we are using the joints, and if we are not taking care of the joint, then it will show degenerative changes. That is why all the types of sukshma vyayam. What are sukshma vyayam? All finger movement, your toe movement, the wrist rotation, all these type of exercises are nothing but for the well-being of the joint. So if you want to get rid of osteoarthritis, or if you don't want osteoarthritis in life or wear and tear to be subsided, then we need more regular and rhythmic exercise. If you say I have to work every day, working every day is not equivalent to rhythmic exercises. So whatever exercise you are doing every day, it will take care of degenerative changes in the joints. Are you understanding and getting my point? Okay. So who suffers from osteoarthritis the most? Number one, people who are not exercising regularly. You need to exercise every day. Number two, if the person is overweight. Being overweight is very, very important point, because if a patient is coming to you, like I have a patient who is 110 kg, she's a lady, she's 110 kg and she is having severe knee pain. And whole body has got a lot of adipose tissue, but the calf muscles and the area below the knee is very thin. So do you think that legs are able to take the weight of the whole body? So where would that weight go? That weight is actually bore by the knee. So knee is actually what will you say? It is actually the area which is suffering, which is getting all the pain of the body. It has to take the weight of the whole body. Okay, so it shows the degenerative changes. So that is nothing but the osteoarthritic changes. So for osteoarthritis, you will see when a patient comes to you, there are again two things. Like in case of gout, you saw that ESR would be high, you saw that uric acid would be high, you saw that neutrophils would be high. X-ray will show the changes. Similarly, in case of osteoarthritis, the calcium level would be low. That is why it is said that after the age of 40, maintaining calcium and vitamin D at normal level is very important. Because if you want to take care of the joint, then calcium level should be good. Okay. Second thing is X-ray. X-ray report will also show osteoarthritic changes, and especially the joint. I'll show you one picture. Let me show you that picture. So this is an X-ray report of a person who is suffering from osteoarthritis. It's a picture of it's a X-ray report of knee. So you can see normal space This is a space, so normal space between the two bones, and also the surface is smooth. But here you can see there are bony spurs. Can you see this pointed edges all over? Pointed. These are nothing but the spurs, S-P-U-R. Okay, it is mentioned here, S-P-U-R, spur. And also you can see that the distance between the two joints has reduced. Here you can see sufficient amount of space, but here the space is less. Okay, so if someone, okay, since we are short of time, but still I'll tell you, it's a very important and very good tool of diagnosis. See the other picture, then I'll tell you that diagnostic tool. See this. First see this, and then see this. So this is healthy knee where the gap is sufficient, and this is the knee which is affected. So you can see that there's very less gap here. So this is what the patient will come with, because the patient will say, the doctor says that the gap between the knee has reduced. This is where you have to work. Reduced knee space, or reduced space between the joint. Okay. What I was telling you about some type of diagnosis is, if the patient, you will see there are different type of patients who come to you. So this is knee area, this is thigh area. So look at this thigh area. If both the thigh areas are touching each other when the patient is standing, if both the thigh area are touching each other, you will get an X-ray report where the medial space of the knee is reduced. This is a diagnosis I'm telling you. Right? Because if both the thigh areas are touching each other, you will get many people who stand with crooked leg, where the legs are slightly turned inward, and you will see that they touch the thigh area is touching each other. So more of the pressure is falling on the medial side of the knee. So if you compress more of this area, don't you think the space would be lesser than this area where the space is less, where the pressure is less? So if I press this area more, lesser space between the gap, and here it would be more. So this is also a cause of huge pain for the patient. So this is also a symptom of osteoarthritis. Okay. So majorly the major joints of the body suffer from osteoarthritis, because those are the joints that bear the weight of the body, or those are the joints which are most movable joints. Is this correct? Is this okay with everyone? So one was gout, second one is osteoarthritis. Okay. So for gout, the reason is uric acid. These are the crystals which are getting accumulated in the joint. It starts from the smaller joints and then move on to the bigger joints. In case of osteoarthritis, it is a degenerative change of the body. Gradually happens in the life. Major joints are affected. No deposition is there, but there is surface erosion. Surface is becoming rough. Maybe some spurs or spine-like structures which are present on the joint. So these are the two types of arthritis which we discussed right now. Okay, we'll start with third type of arthritis. We are left with rheumatic heart disease. We are left with rheumatoid arthritis. We'll discuss it tomorrow. The both are very, very important and very interesting to understand and diagnose. If a patient comes to you, you can easily make out what type of problem the patient is suffering from. If you have